Zoom? Are you on a lot of Zoom meetings?
No, not really, except for my family. And then we've got a few telemedicine dermatology appointments, but no, we haven't been doing too many, but just a few.
Well, it's nice because it's a new way to connect with each other, since we, I wanted to ask you what was your thought process when we found out we were going to be staying at home? Because, you own a business. So, I mean, you had to pivot and change things, right? So what was your thought process when you heard about when we were going into lockdown?
Well, I think first, as kind of a physician, I had kind of the thought, well, even though we're dermatologists and we don't have tons of emergency appointments, we can't completely shut down our clinic. So we need to keep it open so that the people who have skin issues that are more emergent aren't shifted to the urgent care and get exposure to, the COVID virus. So we, as a company, decided that we probably wouldn't have too many, and we have enough staff members that we were going to rotate through. So I work every 7th day, but still having a staff of 22 people, I wanted to make sure we took care of our employees. So we did apply for the PPP loan, and we've continued to luckily be able to keep everybody on salary. So we're taking care of our employees, but also taking care of the Frederick community, any urgent skincare issues. So it was kind of twofold. I needed to make sure we took care of the business and our employees, but also the community. So, but it's pretty stressful.
Yeah, I would imagine it's extremely stressful. I mean, so how are you adjusting to working from home and also having your kids at home? Are you homeschooling?
My husband is in education, so luckily he has it kind of falling on him a little bit more than I do. But I think we're adjusting pretty well. I think for a person like myself who's so used to being so busy, I think that transition to slowing down and, looking at the glass half full, saying, okay, I may not be running wild with all the things that, I enjoy to do, like so much work and such, but slow down, enjoy family, and some of the other things that you wouldn't be able to do necessarily unless you were locked up like this. So exercise, go outside, enjoy nature, take a ride in your car, do Zoom meetings with family members you haven't talked to in a while. I guess that's my way of kind of coping.
Oh, I meant to ask, what type of tea are you drinking?
Chamomile for relaxation. So
very nice.
Yeah, I was in the office today, so I got home and I was like, okay, time to decompress before we met.
Yes. So for our Facebook friends, if you have any questions that you'd like to ask Dr. Moe, just put it in the comments and, I can ask Dr. Moe anything you'd like to know about skincare. So actually, I did want to ask, while we are quarantined, is this a good time to sort of give our face a break? Like maybe not use makeup, or are there home remedies we should do? What would you suggest to help us with our skin during this time? Do you have any tips?
Well, I think that one of the main things is a lot of times when you're going into work or you have a busy schedule, you can allow for any downtime. So as we spoke in the podcast before, if you're going to start something like a retinol and you do have a little irritation to begin with, it really doesn't matter, right? Because you're not really seeing that many people. So if you want to start getting on your retinol, doing that nightly, and slowly getting your skin acclimated. If you have a little dryness, redness, or scaliness, it's not that big a deal because, again, you're not out in the public as much and you can kind of acclimate at home.
This is actually the perfect time to have oh, I'm sorry.
Procedure.
Yeah, I was going to say this would be the perfect time to have a procedure, like to have,
I know. I actually, I got a laser procedure myself. I'm healed. It was 2 weeks ago, but I was like, this is it. This is a perfect time. But for people at home, I think starting a retinol would be a good thing, because if you have any irritation or, an inability to tolerate, you'll be able to at least give yourself time without anybody seeing you to acclimate. Same thing, like if you're going to do any at home, like chemical peels, little alpha hydroxy peels. We kind of spoke about some of the different brands that I like. I think Neutrogena and La Roche-Posay are nice ones over the counter, where if you were going to do some exfoliation treatment, and again, most of the time, if you're doing an over-the-counter treatment, it's not going to be too strong. But again, if you had some too much pinkness, a little scaling, a little more downtime than you would otherwise want to see if you were going out to work or social events, it's the perfect time to do it. As far as makeup, I mean, I don't think makeup's horrible for your skin, but I think if you give your skin a break where you keep it nice and clean, good moisturizer, just like, with your hair too. Like a lot of times you'll like do a mask to detoxify. There's different masks that you can use. And again, the over-the-counter brands that I like are like Neutrogena, the La Roche-Posay, just to give it a little detoxification and rehydration. And you've got the downtime. So if you're sitting 20, 30 minutes with a mask on your face, it's not that big a deal, because you have all the time in the world at your home now.
Do you actually have any home remedies, sort of natural in our kitchen? Do you have any ideas for a facial mask on that? Like I've heard egg whites before and honey, oats, or is that,
I don't have any particular ones that like off the top of my head that I could give you, but I mean, even just like, some of those ones, see, again, I don't have like a particular one that I'd say, oh yes, this is definitely safe. But in general, like a little bit of a kind of a mechanical exfoliation with like a sugar scrub or something like that, that's not bad. But I don't have a particular one that I would say, do this.
Okay. So when you talk about retinol, what do we use retinol for? Like, why is that important, and why does it scale our skin? Can you go back why we would want to use retinol?
Yeah. So retinol is vitamin A, and vitamin A has been around for a long time. And there's a lot of different makers that have retinol as their kind of primary ingredient. But essentially what retinol does is it does several things. It stimulates collagen, it prevents the collagen from breaking down, and it changes the way your DNA turns your skin over. Because as you get older, your skin doesn't turn over as much. So you develop this sallowness, and you don't have that glow, and you develop more brown spots, and your wrinkles look deeper. So if you put a retinol into your nightly routine, it has so many benefits, and there's so many different formulations. So if you're having a hard time finding which one works for you, I would suggest coming to a dermatologist, because if you ask any dermatologist what is, okay, let's say the top 2 or 3 things they use, they're all going to say a good sunblock with broad spectrum in the morning. Most of them say an antioxidant to prevent other environmental damage from breaking your skin down. And then at nighttime, a retinol. You do not use retinols during the daytime because the ultraviolet light will break it down. So that's why you put the retinol in at night. And even if you can only use the retinol every other night, you'll still get the benefit from it. And it usually takes 3 to 4 months to make a difference on how it changes the DNA. But if you can so slowly acclimate your skin into tolerating it, you get the benefit. And after a couple of weeks, you should not be peeling. If you have a good retinol, that stops. I always have patients come in and they say, oh, my retinol, it does a nice job. It always makes me peel a lot. No, after a couple of weeks, you don't want your retinol to continue to peel your skin. You want your skin in balance.
Okay.
And after a couple of weeks, retinol shouldn't be doing that.
Now, how do you use retinol? Like, how you say you use it at night, how much of it do you use? And like, what part of your routine is it in,
So this is really important. So when you use a retinol, you take 1 pea size amount onto your fingertip, and then you've got it on your fingertip, and then you'll put it on your forehead, your cheeks, your chin, just that one pea-sized amount, and then you rub it in. Don't get it too close to your eyes or your nasal creases, because that's where you get more irritated. But in general, you try and do it right after you wash. If you give yourself about 5 minutes from washing until you put your retinol on, that increases its tolerability. And then after that, you can put your moisturizing cream on if you feel like you need moisture.
Now, what type of retinol should we get?
So the best one over the counter is one that I spoke about on your podcast, and that's called adapalene or Differin. That was prescription strength, and then they just put it in the over the counter area in the acne aisle. So
Okay.
retinols help with acne too. So a lot of middle-aged women with the hormonal changes are dealing with acne on their lower half of their face.
Yes.
So besides preventing the aging process, after 3 or 4 months, you should notice your acne improve too. And also, as we spoke on the podcast, those little white cysts, those milia.
Oh, yes. I don't like those.
And the retinol will help prevent those too.
So, okay, so we can get those on the drugstore. We don't have to have them prescribed. So that's good to know.
No, especially if you're just starting out, the Differin 0.1% gel in the acne aisle is a great one to start out with.
Okay. Now I have Gail Novak is asking, what should our sunblock include? Thank you, Gail, for the question. Please,
Yeah,
everybody,
you,
comment
Gail.
in the comments.
So on a daily basis, I like to have a 30 sunscreen on as far as the level. And I like to have some water resistance. Generally, if you have sensitive skin, try and use the ones with zinc oxide and titanium dioxide. Those are safer and they're less irritating. And then if you have a problem with pigmentation, where if you have melasma or like all these brown spots on your face, if you choose a tinted one, that has additional protection against visible light so that the dark spots don't darken up as much.
Now, should you wear sunscreen when it's overcast? Like
Definitely.
if it's raining, do you need a sunscreen when it's raining?
Yes, every single
Really?
morning when you brush your teeth, you even if you don't wash your face, put sunscreen on, because especially for lighter skinned individuals, even if you're traveling to and from for your errands and going to the grocery store when it's raining, you're still getting sunlight, ultraviolet rays that are putting you at risk for skin cancer and also causing wrinkles and age spots if you're not wearing that on a daily basis. So if you're not in the habit of wearing a sunscreen, try and get it, because now it's gone. There's so many nice ones that are so cosmetically elegant that you don't feel like you have anything sitting on your skin. Like right now, I only have a tinted sunscreen on my face besides my eye makeup. There's so many good ones out that you don't have to feel like you have something heavy on, and they really work nicely.
What are you wearing? Can you tell us?
Yes, so there's a brand called Elastin, and I have their tinted Elastin, and it's an SPF 34, I believe. But it's nice because this one, so when in our office, I kind of handpick different products that I like that aren't drugstore, but are kind of the next step up. They're more medical grade. And this one's nice because if you have oily skin, it takes the shine out of your skin. But if you're on the drier side, because I just did a laser to my skin, it makes it not look so it's not so flaky. So it's a really nice one.
Oh, that is great. So if you guys are in, could you give us a heart if you wear sunscreen every morning, like Dr. Moe? Because I'm not really good at that. But if you guys out there, can you give us a heart? I'd love to see the hearts of who actually wears sunscreen every morning, even when it's overcast and raining.
Yeah,
Now,
if you can do that, that is fabulous. Because hopefully, we all have many years to live, and your skin will do so much better as far as cancer prevention and as well as you aging gracefully if you get in that habit.
now you mentioned that you did a laser. What type of a laser, and how often would you recommend that? I mean, are there different, there's dermabrasion, like,
yeah.
and
So
does that tighten your skin? Does laser tighten your skin?
Some lasers do. There's a whole kind of array of different strengths of lasers. And so sometimes if you do a laser, you're going to get more tightening depending on which strength. But lasers, think about it, most of the lasers for skin rejuvenation, the premise is, and again, I think we talked about this on your podcast, think about when you aerate your lawn. You make these little micro injuries into the skin or the lawn. And then once that new brass grows in, it's thicker and plumper. The same thing goes on with lasers or microneedling. You're doing these controlled little areas of damage, but then that skin regenerates and it stimulates new plump collagen and elastin so that your skin, again, creates more of this environment like you had when you were more youthful.
Now, I know this is a little bit off topic, but I was just wondering, does it matter what you eat? Like, does that affect your skin at all? Like, if we have a little bit of wine, does that dry our skin out? Like, yes. Or chocolate? Like, what are your thoughts on that?
So, I mean, the literature
and aging.
The literature in dermatology with food and lifestyle is evolving, but I'm a big believer in all the things you hear about kind of generally keeping healthy, having a good diet with lots of good fruits and vegetables, not eating a lot of processed food, drinking a lot of water, getting an adequate sleep, exercising. I mean, because blood flow in general, if you're kind of exercising, I think it's good for your lungs, your skin. I think also, I already said non-smoking.
Yes. Oh, we're having a little bit of trouble, Kathleen, with your
That's a huge one.
Oh, wait, hold on, Kathleen. We're having a little trouble with your connection. Can you tell us what the huge one is?
Not smoking. Can you
not
hear me?
Smoking. Okay.
Not
oh, yeah.
Smoking.
I can hear you now.
Do not smoke. It's like sunbathing. It's like the worst thing for your skin.
Oh, so we shouldn't sunbathe at all?
Not preferably. I mean, I'm a dermatologist who loves to go to the beach, but you just got to be smart about it. I don't think anybody wants to be a hermit, especially after this whole pandemic and kind of staying put. I think people want to go out. They want to travel. They want to visit like sunny places. So just, you have to be smart about it. I think wearing the sun protective clothing, especially on your kids, because they don't want to reapply sunscreen. If you can wear hats and umbrellas, I think, and then just kind of reapplying your sunscreen after you've been out for an hour or two, if you're sweating or you've been out in the water. I think you just have to be smart about it, but just nothing excessive, no excessive alcohol, no excessive processed foods, try and do all those good things that you hear from all the other doctors.
Okay, so now I want to go back a little bit. I want to talk about Botox and fillers. Mm-hmm. Now, my understanding is Botox is from like the nose up and fillers are like the nose down. Is that correct? And then the other thing I wanted to ask you about, because I don't know much of this, but I was talking to somebody about possibly getting Botox, and they said, well, you have to be careful because your eyelids will droop. So be careful about that. So can you tell me a little bit about Botox and fillers?
Okay, so this is a really common question that people start asking when they hit probably in their 30s. So Botox has been around for a long time. And essentially Botox, Dysport, Xeomin, because Botox went off patent, so it has competitors now. All of those are purified proteins that they go into muscles and they relax muscles. So you have certain muscles on your face that pull your face down. So you have muscles here that pull your face down. You have muscles that pull along the jawline down. You have muscles down here on your bands, your platysmal bands that are pulling your neck down. You have muscles here that when you purse, you get all those vertical lip lines. So if you're doing Botox with someone that does it a lot, that is like a board certified dermatologist, plastic surgeon, yes, you can do it up here. And this is the most common area, but for most people who are doing it a lot, the advanced injections along the jawline, the neck, around the mouth, those, on 99% of my patients, I do it on their full face and neck, because if you can,
Botox?
yes, if you can relax the facial muscles, because I have it on my neck, I have it on my jawline, I have it everything. And you can see I'm not like a Saturday Night Live skit. I can move my muscles. So the goal is not to completely relax them. You want to be able to express yourself. You don't want to look fake. You don't want to look like you've had things done. But if you relax those muscles that are kind of going over and over and kind of crunching in on that skin and causing those wrinkles, you're going to lift up and you're going to prevent wrinkles and treat the ones you have. So that's Botox. The next thing is filler, because beyond the muscles kind of working overboard as we get older and keeping those relaxed and balanced, just think of it as like doing yoga too. If we keep our muscles lengthened, our muscles, we age better, right? So that's what kind of Botox is doing for the face and neck. But for filler, as we're getting older, we have fat, unfortunately, that enlarges in certain areas like our belly and our behind. But for our face, we lose fat. Okay. So filler is used to put the volume back in our face along our mid face, our temples, in front of our ears. And if you keep the volume here, your face stays lifted. So again, you're not overdoing it. You're just trying to get the volume. Think of it as like the hanger to your clothing. If you keep your hanger nice and kind of up and full, then the structure of your face, your skin is going to stay lifted as you get older.
Oh, I like
Now,
that.
these are my Dutch cheeks. These are not filler, but that's essentially what you're trying to do. You're trying not to let things collapse and deflate.
Okay. How about the crow's feet? You know, the crow's feet where you get right here. Is there anything you can do for that?
So that's a little bit of Botox. So a lot of times, again, and especially if you do combination modalities, so a little bit of Botox to relax the muscle, but also if you're losing volume in here, if you're putting a little filler in here, and then if you do a little resurfacing with the laser, it keeps it looking very natural. Because so most of the time when you're doing these things, the goal when a person comes in to see you is they do not want to look like somebody else. They just want to look rested. They just want to look themselves and refreshed, because most people don't feel like they're, 80 years old, but they're starting to see things in the mirror like, I look tired. I just want to look less tired. And so that's the goal. And when you combine those modalities, you keep a more natural look.
That's fantastic. You are so talented. You have a lot of people in here saying that you are really amazing and making everything look natural. You're awesome with injections.
Oh,
So
well, that's
if you
nice.
love Dr. Moe, can you give us a thumbs up and some hearts? Like, let's show Dr. Moe some love. So
Well, I'll tell you, I love my patients too, because after this 6 or 7 weeks I've been here, and every time I go into the clinic, it's like, my patients, I really think that, that's part of why I miss work so much. I just enjoy connecting with all the people that I take care of. And as far as the anti-aging component, I really think that nobody's looking to go back to 21 years of age. We just want to look and feel our best for the age that we are. I think most people are really realistic with that.
yes, definitely. Well, Gail had another question for us, which was really great. She wanted to ask you what you thought about self tanners.
I love self tanners. I think they're very safe. I think the main thing is you try and pick one that is good for your complexion. Depending on how fair you are, you might want to do the gradual ones. So there's a lot of good over-the-counter self tanners like Jergens and Neutrogena. So they're very safe, and I really recommend using them instead of going and getting the natural ultraviolet light to tan your skin.
Now, do you have a trick on doing, do you have should you exfoliate, wash your hands? Because will it get on your hands? Do you have any tips for us on how to use self tanners?
Yeah, because there's nothing worse when somebody puts on their self tanner and then they come in and you've got the orange palms. And I just did self tanner today and I still like white as can be. So the main thing is you want your skin exfoliated, not aggressively where you're rubbing your skin off, but just give yourself a nice exfoliation where you plan to put the bronzer. And then from there, I would say after you apply it, if you don't have gloves, make sure you wash your hands really well. And any area that seems to be a little bit more callous, like sometimes your elbows and your knees have a little thicker skin, try and put it on a little bit lighter there, because otherwise the bronzer is going to accumulate more there and it's going to look darker in those areas. So just spread it a little bit lighter. I like the Neutrogena spray because I can kind of control it better and it's not all over my hands, but I think those would be the tips I'd recommend.
Oh, that is great. So it's interesting that you mentioned a self tanner spray, because the last time we talked, you did not recommend the sunscreen sprays, correct?
Correct, because those you tend not to get on thick enough in order to protect your skin from sunburns. I think for reapplication, I think that they're fine. And if you're really environmentalist, I think that the sprays are not as good as the creams and lotion, because I think, the aerosolized components are less environmentally friendly. But I think the main thing is because most of the time you don't get them on thick enough and they fail because of that.
Now, you were actually telling before about how you should put it on a half an hour before you need it, correct? And then you were talking about the amount. That was something I was really surprised about, the amount of SPF. And is there an SPF number that we should make sure that we hit or go above? And it doesn't matter, like SPF 70, like what should the SPF be?
I think once you get past 50, the additional benefit from the sunblock is pretty trivial. So if you're between 30 and 50, and especially not on a daily wear, but if you're at the beach, if you're using water resistant to 80 minutes, because it doesn't say waterproof anymore, the FDA had the labeling changed, I think you're doing pretty well. And I think, again, the main thing is if you're going to use the sprays, use them for reapplication. And if you think about the amount that you need for your face, I would use like a few teaspoons, but for the body, you need like a shot glass full in order to apply enough lotion or cream to get good coverage. And that's why that sun protective clothing for your kids is so nice, because it's, it's just so easy. And then you're not, trying to get them in from the water to reapply, because there's a lot of good clothing that has the sun protection built in.
That is great. And how often should we reapply?
Every couple hours, usually, unless you have been out in the water. I think if it's been an hour and then you were out in the water for 15, 20 minutes, and it really, most of the time it's going to get washed off. So you should reapply then if more than that, if you're perspiring heavily or if you've been out in the water.
Okay, that's good to know. Well, we're getting ready to wrap it up with Dr. Moe. So if you have any other questions, please ask them now in the comments so we can get them to her before we wrap up. Something I was wondering about, now that we do have some extra time that we're home, you had mentioned about self-exams, how important it is. Can you go over that again in the ugly duckling? I love that so much. Do you mind letting us know one more time what we should be looking at when we do self-exams?
Okay, so this is really important because with dermatology, I mean, the system that you're checking, it's all on the outer aspect, right? This is not like a colon cancer screening. You can really look yourself. And you should be doing it just like your breast exams every month or two. So there's three main skin cancers, and you've got basal cell skin cancer and squamous cell. And those generally occur in sun exposed areas, and more commonly Caucasian people get those. And it's from the sun we had when we were younger. So generally those are going to look like a pimple that doesn't heal. Usually they're pink. Sometimes they have a little bit of tan coloring. And anything that comes up and it's new and it's like a pimple that doesn't heal, maybe it bleeds, maybe it's sore, maybe it's not, but it's new and it's on a sun exposed area. If it's not going away after a couple months, you should really have a dermatologist or at least your primary care doctor take a look at it. But
Okay.
I do think if you're a Caucasian person that has had a lot of sun when you were younger, a once a year appointment with your dermatologist is good. Now, the third type of skin cancer is melanoma, and that's the worst one because if you don't catch it in time, even though our treatments have come a long way to do a better job at treating it, once you have melanoma that's spread, most of the time it will kill you. So again, your earliest defense is catching things yourself or getting into a dermatologist regularly. So you're working as a team to do this. But if you're looking for a melanoma on your skin, most of the time it is going to be pigmented. But how to remember is we call it the A, B, C, Ds of melanoma. So most of the time it is coming from a spot that you did not have a mole. 1/3 of the time, melanoma will come from a mole you had, but most of the time it's going to come from just skin where you did not have anything. So anything where A is asymmetric. So if you're looking at a spot and one side doesn't match the other, then that would be a concerning characteristic. B, if the borders are irregular. So if on the edge of the lesion, it's irregular and it's not smooth or round, then that would be a concerning spot. C is color. And this one's really important. If you have a spot that has several colors in it, so you have something that looks like a mole and it's pink, tan, black, brown. If you've got a lot of different colors within one mole, that is something you definitely should get checked out. And then D is diameter. So if you have a mole that is growing and it's kind of evolving and the diameter is bigger than a eraser head especially, that's another concerning area where you're like, I should get this checked out, because really the best thing is catching things early. So there's no dumb question going to a dermatologist. We have several years of training in order to kind of look and discover suspicious things early. So again, I highly urge, because in Frederick County especially, we have tons of skin cancer.
Oh, wow. So Joe Butler, our good friend, she has dark pigment. She was asking what to do with age spots.
So if it depends on what type of age spot. Sometimes you can get these things, and we kind of, the layman's term is like barnacles. They're like warty growths that come off of you. Sometimes if it's like a more of a thick warty growth, those type of age spots or brown spots, they need a little more aggressive treatment. But if they're flat and smooth, and again, they don't look medically concerning, a lot of times topically, with different things like vitamin C or bleaching agents or alpha hydroxy acids or even retinols, with time, if you're set up on a good skincare regimen, just using good at-home skincare can lighten your age spots. Now, some people say, I have like a wedding or event I've got to get ready for. In that case, we can speed it up and we can use light-based technologies like an IPL or lasers. But a lot of times, if you're like, my budget's pretty limited, I just want to slowly lighten this up and prevent new ones, a good skincare regimen can be helpful.
Oh, that's great. Well, Joe says that her age spots are flat. So
they're flat.
Yeah.
So a lot of times, again, good skincare can help that.
Okay. And she says for dark skin, they're flat and for dark skin.
Yeah. So we have a lot. I mean, unfortunately, it's kind of a blessing and a curse. If you're darker skinned, you don't get the wrinkles as quickly as someone that's fairer, but a lot of times you are more prone to getting sunspots or melasma. So a lot of times you also have to be more careful on those people with procedures. So a lot of times I like to start with skincare because it's a nice, cost-effective and safe way to get their skin becoming more even if you use skincare.
Oh, that is
so
great.
It would be, and with us, kind of, because a lot of people have so many questions, because with cosmeceuticals, it can be overwhelming. So with Frederick Dermatology, like once we kind of open up fully, we even kind of have a designated part where we don't charge you for coming in, but you can have a consult to say, well, my skin is such and such, what do you think I should do? So if you're having problems trying to decipher things at home yourself, you can always consult an expert. And for us, again, we don't charge you anything.
So just for now, we're home. What is a good regimen to do as we're wrapping up? So if you, and again, anybody, if you have questions for Dr. Moe, we're about to wrap up, but I just wanted to say, what is a good routine that we should be doing?
Okay, so it really depends on your skin type. Some people can tolerate more, but if you want a gentle anti-aging regimen, I would say over the counter, I love CeraVe. CeraVe, CERAVE. They have a gentle wash and a CeraVe PM lotion. It's a nice moisturizing lotion that's not too greasy. I would pick up those two things. My favorite over-the-counter sunscreen is La Roche-Posay. I like the tinted one, the tinted 50. It's nice, it's gentle, it's not irritating. And then the only other thing it would be to start a retinol and just see if you can tolerate it. Go to the acne aisle, go and get different 0.1% gel. I know it says it's for acne. You do a pea-sized amount at bedtime, wait 5 minutes after you wash before you put it on at nighttime, start it every other night and put your CeraVe on with it afterwards and give it a few weeks and see if you can tolerate it. But if you can tolerate it, after 3 to 4 months, you're going to have a glow that you never had before. Your skin is just, you'll notice a difference.
Oh my gosh, that is amazing. Well, Dr. Moe, this was so wonderful. You got a lot of hearts and a lot of thumbs up. Everyone was like so excited. And Trish mentioned that May is Melanoma Awareness Month.
Yes.
So thank you so much, Trish, for that.
And I will mention too, I'm sorry to interrupt, if anybody does have something that they're really concerned about, I will say our office doors are still open. I saw a couple people in the last few weeks where we did diagnose skin cancer. So if you're really worried about something and you're like, geez, man, I don't know if I can wait, we'd be more than happy to see you, because again, with skin cancer, the best bet is just early detection.
Okay, that is so great. That is, I think we'll end on that. Dr. Moe, wonderful to see you.
Oh, good
I
to
can't
see
wait
you,
to
Michelle.
person and give you a hug.
Well, thank you so much. And thanks for everybody who called in and kind of asked the questions. I appreciate it.
Yes. All right. Well, have a great rest of your day, and everyone have a great weekend. And tomorrow, just to let you know, a couple housekeeping things. Tomorrow, it's going to be at 10 a.m. Eastern, 7 p.m. Pacific a.m. We are doing cupcake decorating. So,
Yay!
yes, it's fun. She's amazing, and she's fantastic. And also, we are selling jewelry for a cause for Hartley House. So
Nice.
I have these beautiful earrings on. Everything's very reasonable. They have stuff under $50. All of the profits go to Hartley House. We have it open until next Friday. And I'm even giving my hostess gift to Hartley House. So it would just be wonderful. I'm so appreciative to everyone who has already donated, bought things. We've even had people donate money. So thank you for that. So and anyway, so hopefully we'll see you tomorrow live doing cupcakes. And Dr. Moe, thank you again so much for being.
It was my pleasure. And take care, and everybody stay safe.
Bye.
All right. Bye-bye.